Good afternoon. We're here today with Humboldt County Health Officer Dr. Ian Hoffman for the December 18th media availability. Thank you for being here with us. So we're going to get right into media questions. The North Coast Journal asks, the county reported earlier this week that it received 975 doses of the Pfizer vaccine. Do you know how many of those have been administered to date and what the local process is for determining exactly how the line forms to receive those under the state's tiered system? And do hospitals and healthcare providers get to prioritize which members of their staff get vaccinated first?
Yes, great question. So to the first part, I've been in close communication with the hospital administrators in Humboldt County, and I can say roughly about 250 vaccines have been given so far this week, which is pretty amazing. Everyone's working really hard to get these vaccines out quickly. As to the process for which the line forms, there's been an immense amount of discussion up to this point. We've only just started to get through that first part of the discussion, which was to prioritize within phase 1A, and there are 3 tiers there: tier 1, tier 2, and tier 3. So we're currently on tier 1, which includes hospital staff, skilled nursing facilities, EMS, and dialysis. So we're working to get through those. The hospitals and healthcare providers who were allocated their share of the vaccine from public health based on months of research of who their employees are and what category they fit into. They got their allocations this week, and then from there, public health has instructed them to follow the tier guidance, and it's up to those individuals within those institutions and organizations to follow that guidance. So that's sort of how the process is, and I think, like I said, I've been in communication with folks daily about this, and I think it's going very, very well. Thank you.
Thank you. The North Coast Journal asks, what oversight or transparency will there be in this local process to ensure it is not abused and, for example, hospital administrators or board members aren't prioritized ahead of frontline workers who are at the greatest risk?
This is a very good question, and I think it gets to the heart of this whole vaccine campaign. This vaccine campaign is about equity, transparency, and safety. Those are 3 extraordinarily important things that we're trying to adhere to in every step of this process. So, we have allocated out the amounts to the different hospitals, and they are administering these, and they have been given the tiers and the priorities, and they're well aware of it. We've been educating them on it for a while. And so I think that we have to trust the hospitals that they're going to follow those at this point. Now, you might say, well, why does one person get the first vaccine who might not have the highest risk? And there's a lot of factors that go into the timing of these vaccines when they happen. So, they first arrived in the middle of the day. The highest risk workers might not be on shift that time, and they might get it later that night. So they have their list. They know who gets the vaccine. It's all been allocated, and that's who they're working through right now. And so the process is definitely in place, and I can say it's going really smoothly. So we'll keep in touch with them throughout this whole process to make sure that continues to happen in that way, that they stick to the equity, transparency, and safety guidelines. Thank you.
Thank you. The Lost Coast Outpost asks, Lindsey Mendez said in her media availability Wednesday that the county will be receiving 975 Pfizer doses per week. To what extent can we be sure of these shipments? How long are we contracted to receive shipments on this schedule?
Yeah. So as Lindsey said earlier in the week, the Pfizer doses come in shipments of 975 doses. We call them trays, or some people are calling them pizza boxes. We received our first tray of 975 doses on Monday, and I actually just got confirmation we received our second tray of 975 doses of the Pfizer vaccine yesterday. So that's safely in the freezer at St. Joseph's Hospital. And that was actually our first shipment. The one that came Monday was called a pre-positioned shipment. We had our first shipment today, and we're scheduled to get a second shipment of Pfizer, another 975, on Monday or Tuesday of next week. So those will continue to come in 975 allotments. And now some of those are allotted to other counties because we are holding on to a dose for Del Norte County. Beyond that 975 dose shipment should hopefully keep coming each week. That's the plan. But as we've all seen in the media, there are reallocations going on. So we are going to go based on what we know is coming for each week when we put the order in, and then we'll allocate it based on what we are certain is going to be coming in that next week.
Thank you. The Lost Coast Outpost asks, how many citizens have been vaccinated so far, and is it possible to regularly release vaccination statistics on the county's dashboard?
Yeah, great. So like I said, about roughly 250 people have been vaccinated so far in Humboldt County, which is fantastic. We're moving swiftly through the first allocation, which is good because we want to use it up as we get it. And we are working on something like that. So far, it's just been texting with the hospitals to say, how many did you do today? But there is a very high level accounting of this through the state's vaccine program. So we will get reports as this goes in. But for now, we're keeping a very close track of it, and we would like to put it on the dashboard as soon as we can. We just want to make sure we put out accurate information. But I can say right now about 250 have been given out, which is fantastic.
That is exciting. The North Coast News asks, it seems like this vaccine came quickly since the start of the pandemic, but there's obviously a lot of work before this. What is a realistic timeline for how long it's taken to get this vaccine up and running?
Yeah, I'll be the first to admit, I was skeptical about this timeline. I thought we were looking at well into 2021 to get the vaccine. But as I learned more about this new strategy and approach, I realized how and why this happened so quickly. So this is definitely the fastest we've ever put out a vaccine in the history of humankind. This is an mRNA vaccine, which is not a new approach. It's actually been around for many, many years, but it's the first time it's been used in a vaccine in this nature. It was originally made for cancer research, but they found that they could use it in strategies like a virus like coronavirus or COVID. So the timeline is realistic. I mean, it's here. It's been through all of its trials, and it's been through all of its approvals, and it's safe and it's effective. So we're just excited that happened quickly, and now we can move on to end this pandemic.
Thank you. The North Coast News asks, we understand summer 2021 is a more realistic timeline for mass amounts of people to get vaccinated. What is the most realistic timeline for Humboldt County specifically to have the general public vaccinated? So we're going to move through the tiers as quickly as we can. We talked about the phase 1A and the 3 tiers that we have for healthcare workers. There's different estimates on when that could happen. It could be as early as January. It could be February or March. Different estimates based on how much vaccine is produced. There is a second vaccine coming, Moderna, which is going to be hopefully arriving next week as well. I can't give any definitive or realistic timeframes because they really depend on
things that are happening in those factories where they're making the vaccine. But if we can continue at this pace, I would say that it could definitely be into spring or early summer that we could have as many people vaccinated as possible in this country and in Humboldt County. Because the way things are going, it's happening very smoothly and fast, and it will depend at that point on the vaccine manufacturer's ability to keep this coming to us.
Thank you. You've already answered this, but the Time Standard asks, how many people have been vaccinated so far, and when does the county expect to exhaust its current supply of vaccines?
Yeah, so as I mentioned, about 250 so far. We want to go through this quickly. So like I mentioned, we have a second tray already here. We want to get through that first tray. So we're hoping that'll happen, potentially as early as next week, and we'll start into the second allotment. And we hope that by the time that third tray comes next week, that we would be nearly done or close to done with that second one. And then we would start using up the third one.
The Time Standard asks, at a virtual town hall last night, the state OES Deputy Director of Planning, Preparedness, and Prevention, Lori Nazora, said the allotment of vaccines was reduced for most states, including California. How will this impact Humboldt County?
So I wasn't in that meeting last night, but what I can tell you so far, what I know is that has only been affected at the state level. What we've been told for our allotments and what has arrived here has not changed at all. So we're hopeful that in the next shipments, we continue to get what we've been promised.
The Time Standard asks, is the county concerned about whether people might be reluctant to get the vaccine? How would this impact the development of herd immunity?
Certainly there is concern out there because we know that there are folks who might not like vaccines or might not want to take them. But what I'm seeing right now, I don't have any concern. I've never seen this level of enthusiasm, this level of uptake of a vaccine. So where we're at right now, I'd say very hopeful that this vaccine campaign will be extraordinarily well taken and reach our goals.
Thank you. The Red-Headed Black Belt asks, have there been any instances where a healthcare worker locally declines to take the vaccine in favor of a later option, or to wait to get a different vaccine, or decline to take it for any reason?
Since we're not administering the vaccine, I can't answer this question. I'd say that's more of a question for the hospitals who are currently administering the vaccine. Thank you.
The Red-Headed Black Belt asks, are staff members at Granada being considered for vaccinations?
Absolutely, yes. So the Skilled Nursing Facility program is run through the CDC in partnership with CVS and Walgreens. And they are slated to have their own allotment of vaccine. And that is scheduled to begin the week of December 28th. So public health has been helpful in getting those folks enrolled, but we're not involved in allocating that vaccine to them.
Thank you. And then last question, the Red-Headed Black Belt asks, can you talk about why it would or would not make sense to vaccinate a facility's staff and members during the midst of an outbreak if in some theoretical world we had all the vaccine we needed?
Yeah, there are certain folks who we would recommend against vaccinating in the healthcare field. So anyone who's on quarantine, they shouldn't be getting a vaccine because they could be potentially exposing the vaccinators and the people around them in that healthcare facility. So those people would be asked to wait until their quarantine was over. There's also some debate around whether or not someone who's had a recent positive COVID test should get the vaccine now. Currently recommending waiting the 90 days because the risk of reinfection in that first 90 days is extraordinarily low. But in all the facilities, anyone else, we will absolutely be vaccinating. And we want to do it quickly because it'll take the full 28 days to get through the first dose and then the second dose 21 days later. And then we know that the full immunity happens around 28 days based on the studies done. So we, the folks in the skilled nursing facilities will get vaccinated even if there are outbreaks there based on the guidelines put forth by the CDC. Thank you.
Excellent. Thank you so much.